Ever heard of the three letters that can bring a mix of concern and curiosity, SCC? What exactly is SCC, and what issues might it stir up? Join me on a quest to unravel the mysteries surrounding squamous cell carcinoma. What signs should you look out for, and why is it making its presence known? If you're curious or perhaps a bit worried, you're in the right place. Let's explore the world of SCC together, and feel free to share your questions and thoughts along the way. Tanya, a passionate sportswoman who enjoys playing cricket, became concerned when she noticed red spots on her skin that later turned into ulcers. Worried about the possibility of skin cancer, she took the responsible step of booking an appointment with her general practitioner, GP. The GP, recognizing the need for specialized care, advised Tanya to see a dermatologist. The dermatologist, an expert in skin conditions, conducted a thorough examination and decided to take a biopsy to get a closer look. Tanya anxiously awaited the results, and during this time, the term cancer weighed heavily on her mind. When Tanya returned to the dermatologist's office, the specialist used clear and simple language to explain the situation. He confirmed that Tanya had squamous cell carcinoma, SCC. Although the word cancer can be alarming, the specialist took the time to provide detailed information, helping Tanya understand the condition better. Doctor, what is squamous cell carcinoma? Squamous cell carcinoma, SCC, or cutaneous squamous cell carcinoma, CSCC, is the second most common form of skin cancer after basal cell carcinoma. It starts in squamous cells in the outer layer of your skin, the epidermis. Usually, squamous cell carcinomas form on areas of your skin that receive the most sun exposure, like your head, arms and legs. Cancer can also form in areas of your body where you have mucous membranes, which are the inner lining of your organs and body cavities, like in your mouth, lungs and anus. Doctor, what are the types of squamous cell carcinoma? There are different types of squamous cell carcinoma based on where and how much cancer is in your body. Cutaneous, cancer that only affects the top layer of your skin, in situ, or cancer that's spread beyond the top layer of your skin. Metastatic, cancer that's spread to other parts of your body beyond your skin. Doctor, who does squamous cell carcinoma affect? Squamous cell carcinoma can affect anyone. You're most at risk if you have long-term sun exposure or sun damage to your skin at a young age. Have a pale complexion, blue or green eyes, blonde or red hair. Are 65 years of age or older. Have a weak immune system or received an organ transplant. Had chemical exposure, cigarettes, arsenic. Male are about 2 times more likely to develop squamous cell carcinoma. People over the age of 50 are most likely to get SCCs, but the incidence has been rising in people younger than 50. Doctor, how common is squamous cell carcinoma? Over 1 million people receive a squamous cell carcinoma diagnosis in the US each year. The rate of SCC has risen about 200% over the past 30 years. Symptoms of squamous cell carcinoma include skin changes like a rough feeling, bump or growth, which might crust over like a scab and bleed. A growth that's higher than the skin around it but sinks down, depression in the middle. A wound or sore that won't heal, or a sore that heals and then comes back. An area of skin that's flat, scaly and red that's larger, about 1 inch, 2.5 centimeters. There are cancerous bumps, marks or lesions that form on your skin that can be a sign of squamous cell carcinoma, including a bump or lump that can feel dry, itchy, scaly or have a different color from the skin around it, actinic keratosis. A lesion on your lower lip where the tissue becomes pale, dry and cracked, cheilitis. This may have a burning sensation when you're exposed to the sun. White or pale spots in your mouth, on your tongue, gums or cheeks, leukoplakia. You can have squamous cell carcinoma on any part of your body, but it's most common on your skin. Mouth, tongue and throat, oral carcinoma. Face, lips, nose, ears, eyelids and scalp. Stomach, esophageal or epidermoid carcinoma. Hands, arms and legs. Anal cavity. A mutation to the p53 gene causes squamous cell carcinoma. The most common way that your p53 gene mutates is from ultraviolet, UV, exposure from the sun, or from using indoor tanning beds. The p53 gene provides instructions for your cells to divide and replicate to replace cells when they reach the end of their lifespan. Your p53 gene is a tumor suppressor, which means that the gene controls how much and how often your cells should create new cells. Too many cells create tumors, which can be cancerous. Cutaneous squamous cell carcinoma rarely spreads to other parts of your body, metastasize. If this does happen, it occurs slowly and can be life-threatening if left untreated. If you notice changes to your skin, contact your healthcare provider immediately. Your healthcare provider will physically examine the area of your body where you have symptoms, looking specifically at the size, shape and location of the lump or lesion. Your healthcare provider will also ask questions to learn more about your medical history and your symptoms, which could include, when did you notice the lump or lesion on your skin? Did this lump change in size from when you first noticed symptoms? Is it painful or itchy? After your physical exam, your healthcare provider might offer tests to confirm a diagnosis, which could include skin biopsy, removing a small sample of the affected tissue to examine it under a microscope. Imaging tests, CT scan or MRI. Your healthcare provider will use an imaging test to identify the size of your carcinoma underneath your skin and to see if it's spread to other parts of your body, especially your lymph nodes.